This video is brought to you by Senior Life Simplified. Enjoy the video.
Welcome to our channel. Today we're diving deep into the world of home oxygen therapy. It's a lifeline for many people, yet often misunderstood. Let's break down what it is, why it's used, and how it can be managed effectively at home. Home oxygen therapy is prescribed when a person is unable to get enough oxygen naturally. Conditions like chronic obstructive pulmonary disease, or COPD, severe asthma, cystic fibrosis, or even heart failure can lower oxygen levels in the blood. Supplementary oxygen helps maintain adequate oxygen in the blood, offering improved quality of life and enhanced energy levels. Who might need home oxygen therapy? Individuals experiencing difficulty breathing, constant fatigue, or low oxygen saturation levels may be candidates. Typically, your doctor will conduct tests to determine your oxygen levels and decide if this treatment is appropriate for you. Oxygen is delivered through a nasal cannula, a thin tube that rests in the nostrils, or a face mask, depending on doctor's recommendations and patient comfort. Portable oxygen concentrators and tanks make mobility easier, providing flexibility and maintaining independence. It's crucial to follow the prescription accurately. Using too little won't improve symptoms, while too much can lead to adverse effects. Also, regular follow-ups are necessary to monitor your condition and adjust oxygen flow if needed. Safety is a top priority. Oxygen supports combustion, so avoid smoking or open flames near oxygen equipment. Ensure devices are well ventilated and checked for leaks. Notify local services so they are aware of your oxygen use in emergencies. Lastly, managing home oxygen shouldn't feel overwhelming. Online communities and local support groups offer advice and encouragement, connecting you with others sharing similar experiences. Understanding home oxygen therapy empowers you to use it effectively, enhancing your health and lifestyle. Remember, it's about finding the right balance and support. Thanks for watching, and don't forget to like and subscribe for more insights into health topics. Stay tuned for our next video.
Thanks for watching. Please like, share, and subscribe if you have not done so already, so you don't miss out on any of our upcoming videos. Also, you might like some of our other channels we have on YouTube, like short Bible stories, hard biblical questions, and top 10 most loved Bible verses. Please check them out. I think you will enjoy them. Thank you and God bless.